Second day in a row, Person County ran out of doses after vaccinating about 200 people. Many people we talked to said they came out as soon as they heard people as young as 65 could now get the vaccine.
And today, CBS 17 uncovered that Person isn't the only county out of doses.
Only on CBS 17, Bridget Chapman spoke to a health director who says the state's online tracking system is the reason he can't give the vaccine to more people.
Yeah, Maria's Angela, Halifax County's health director tells me that when it comes to these numbers, the state has them wrong. Numbers from the state this week showed some counties in our area have used 15% or less of their allocated first doses of the COVID-19 vaccine, Halifax being one of them.
When you told me that the state reported 15% or less of our allocation being used here, I was shocked.
Health Director Bruce Robusto says that's because they've actually exceeded their allocation. He says every dose they've received, they've put in someone's arm. They even asked for more doses to administer from a neighboring hospital.
We've had an incredible turnout.
He says the problem is the state system they upload the data into, called CVMS.
The CVMS program is a program that is designed to make everything flow well, from reordering medication to keeping track of who's been vaccinated with what. It's a great program, but it's new.
They've had trouble accessing it and entering data, leading the system to show they've done less than they have. Future allocations depend on the numbers they enter. He says they've already received fewer doses because of it.
The last thing we're doing is underperforming. We're just having difficulty.
He's called for volunteers across the county and help from the National Guard. Edgecombe and Vance counties also tell me the state's program numbers aren't up to date.
It's just finding the kinks to work out in that system here at the beginning, and I'm sure we'll get there.
Health Director Lisa Macon Harrison says the issue they've had in Vance is registering people.
It doesn't take long to give shots, but it does take a while to enter all of the other data and information that will be lagging.
We took the concerns to the state, which they said they're working on.
The underlying system works, but we recognize that it takes effort to put the data into the system, and that means people and time, and that's what we want to be here to help with.
Saying they especially don't want this to keep anyone from getting more vaccines.
The more people have access, the better, so we're all looking forward to that.
We've been calling every health department we can get a hold of to see if they're also having issues with this system. We'll have those results for you tonight at 11. Reporting live in Raleigh, Bridget Chapman, CBS 17 News.